Hello everybody. Today we are going to discuss about asthma, care of child with asthma or wheezy child. So basically this is more about those childs who has asthma and you as a carer know a bit about it. So I'm just going to overview about it. So basically, you know what is asthma. Asthma is a repeated attack of difficulty of breathing. Air gets in and out of the lungs through thousands of tiny breathing tubes. Um, and during asthma attack, this small breathing tube becomes so narrowed that it's harder for the any person, means child, to get the air in and out of the lung, and air whistles through this narrow breathing tube, and we can hear that either without any stethoscope, sometime, and sometime with the use of stethoscope. Usually between asthma attack, the breathing tube returns to normal and has no obstruction to breathing. So how common it is in asthma is very common, and it affects 1 in 10 children. So it is one of the most common childhood disease. And many of the children are not recognized to have asthma, and usually these episodes, wheezy episodes, are common under 2 years of age. Due to virus, and majority of the cases, children are outgrow of this problem. Now, how it is diagnosed? It is actually by the healthcare professional about that repeated these types of attack, and your child will have some of the symptoms like coughing, spasm, mainly night, wheezing episodes, especially at night when exercising or on contact with animal, and other allergic disease such as hay fever, eczema, that increases the propensity. And relief with asthma, relatives, if there is a family history, we take the family history, whether there is in relatives has asthma or hay fever, that also increases the risk of having asthma. So what brings this asthma attack? A child with asthma airways are very sensitive. There are number of things that can trigger is asthma attack or symptoms. Whenever someone with asthma come into contact with that trigger, asthma can develop and last for many days. Common triggers are can be cold weather, can be exercise, excitement, stress, contact with allergies like house dust, animal, pollen, feather, infections such as common cold, flu, tobacco smoke. So most important factor is to avoid the trigger. Many trigger such as cold weather, exercise, uh, not always, the cold, flu, etc. You cannot. Animals such as cat and dogs may have to remove from home if child is strongly allergic to them. It is possible to reduce house dust in home, but is impossible to get rid of it altogether. And parents should try to stop smoking. So basically, very important that your child, if it is asthma, so should have an if it is needed to visit the GP, and of course it is important that you know the signs when that is getting worse and when to do the medications as per the direction of the doctors. So basically, I will tell next time about how to look after your child, and what the signs you look and check on your child's breathing, and what are the treatments available for that asthma, and about a little bit about the spacer. But you have to very importantly always remember when to take to the emergency, like call a 999 if the child's become exhausted, very drowsy, difficult to awake, very pale, blue gray around lip, very agitated. uh, in that case, you have to ring 999. We'll talk about more about asthma in the next section.